Dr. Sally Benson from the Art of Braces, and I'm so excited today to be doing this collaborative video with my colleague and good friend, Dr. Levi Sorenson from Sorenson Pediatric Dentistry.
Hi, glad to be here.
All right, so today we just wanted to put together a quick video for you guys to talk about some common problems that we see with some younger children and some things that you parents can kind of watch out for with your younger kids.
So the first question that I have from many parents is they have children that are sucking their thumbs, having habits like that, and wondering how critical it is to end those habits.
Yes, that is a great question, and a lot of times when I see kids for the first orthodontic consultation, I'll see certain signs, like for example, there might be some spacing and their front teeth might not touch. And usually when I see that, I'm thinking in my head already, okay, what is the cause of this spacing? A lot of times there is an underlying habit that created the spacing. So for example, a tongue thrust habit, which is when a child is constantly resting their tongue against their front teeth. It's something that a lot of times kids aren't even aware that they're doing until I bring it up to them. So if you see that your kid is constantly pushing their tongue against their front teeth, that is a habit that needs to break. Another thing too is the way that they swallow. So if young kids have what's called an infantile swallowing pattern. This is something that starts out when we're infants because we don't have all of our teeth yet. And in order to swallow, you have to have a seal in the front. And since they don't have teeth, they push their tongue forward to create that seal. Usually, as the teeth come in, they transition into what's called an adult swallowing pattern, which is when they put their tongue up to the roof of the mouth when they swallow. This is how we should be swallowing. And if you're not swallowing that way, then you have a tongue thrust habit. Other habits that I see are thumb sucking, which is a big no-no, as well as finger sucking. And this also extends to using a pacifier for longer than you should as well. Dr. Sorenson, I typically don't see kids who are using pacifiers. That's a little younger than my typical patient, but what age do you recommend that kids stop using a pacifier?
So our recommendation is usually around age 3 is a good time. And the reason for that is that as the child gets older, their bone gets more dense and the teeth won't relapse. So if you can do it before age 3, the teeth will actually go back to where they were before.
All right, perfect. Any other issues that you see in younger kids that your parents might be asking you about?
Yeah, so we have a lot of parents that ask, it's just a baby tooth, do we need to fix the baby tooth? What is the importance of the baby tooth?
Yes, that's a great question. We are lucky that we get 2 sets of teeth in our lifetime, and so sometimes if you're told that your child has a cavity on the baby tooth, your gut reaction might be, well, they're going to get another tooth after that anyway, why don't you just take it out? Well, the baby teeth actually serve a couple of important functions aside from allowing your child to chew and eat. The baby teeth are very important in holding the space there so that the adult tooth has room to come in. A lot of times I see kids that come in and they lost a baby tooth before they were supposed to. Maybe it was taken out because of a cavity, or maybe they lost it because of some type of dental trauma. But if there is no space maintainer put in place, then the adjacent teeth are going to start drifting into that space where the baby tooth was lost, and then that creates further problems down the road. Then the adult teeth that follow don't have the room to come in. So if your child has to lose a baby tooth early, then we recommend that you always make sure they have a space maintainer to hold that space until the adult tooth comes in. All right. And usually the space maintainer is placed by the pediatric dentist who is taking the baby tooth out. I know Dr. Sorenson is always pretty good about putting space maintainers in place. But if your child loses a baby tooth on their own and you're not sure if it was supposed to come out yet, just bring them in to their pediatric dentist and ask and make sure, hey, my my son lost his baby tooth. Is that okay? Do we need to put a space maintainer in place? And speaking of losing baby teeth, one of the most common things that I see in terms of why a kid loses a baby tooth is because of dental trauma. So if they're playing any sports or they fall and they get hit in the face. Dr. Sorenson, what should a parent do if their child gets their front tooth knocked out?
So the first thing is, if it's a baby tooth, then you don't want to try to stick it back in, because you can damage the developing adult tooth. If it is an adult tooth that gets knocked out, you want to be very careful with the tooth, and you want to try to put it in either milk or Gatorade to keep the tooth alive. If you don't have any of those, you can actually stick it in your own mouth. The saliva will actually help to keep the tooth alive. And then you'll want to get to your closest pediatric dentist as fast as you can, and they can actually save the tooth.
And when you say as fast as you can, what is that, like 1 hour, 1 day, 1 week?
So, I mean, obviously it's as fast as you can, but most of the studies show that if the tooth can be put in within an hour, then it will have a good outcome.
All right. And then what do you recommend if they can't get a hold of a dentist right away and then they end up in the emergency room? I know you have a story about that.
Yeah, so I have had some kids that go to the emergency room with a lost tooth, and the emergency room will stick it into hydrogen peroxide, and then that ends up killing the tooth.
Yeah.
And so just very important to make sure that the tooth is in something that can keep it alive.
Yeah. And so speaking of dental injuries, make sure if your child is playing any sports that they're wearing a mouth guard. This is, whether they have braces or not, they should always be wearing a mouth guard to protect their teeth. And then also just be careful if you have more than one kid. I have unfortunately had many stories that parents have told me about their kids just, wrestling and fighting. And I had a patient who hit her brother with a pole and broke his front tooth in half. And so unfortunately that is something that this poor kid is going to have to deal with for the rest of his life, getting crown after crown, replacing that front tooth. I also had another pair of siblings where the older sister slammed the door into her younger brother's face. He's only 2 years old at the time, knocked out his front 4 teeth. Those teeth don't come in until age 7 or 8, so he walked around with no front teeth for 6 years, poor kid, and also developed a speech impediment because the front teeth are important in order to be able to enunciate certain sounds. All right, another thing I wanted to ask Dr. Sorenson about is baby bottle decay. Can you talk a little bit about that?
Yeah, so we do see cavities in really young children, and so as pediatric dentists, we would rather prevent cavities than have to fix them. And so some of the biggest things you could do to prevent that, avoid milk at nighttime. So the recommendation is that after the child's after you brush the child's teeth at night, no more milk. Water's fine, but nothing to eat or drink after that. That can help a lot. The other part of it is, as far as bottles and sippy cups, they recommend to discontinue bottles and sippy cups after 18 months old.
All right. And then what age should kids begin flossing?
So flossing can be, it's different ages depending on the child's development. So as soon as any of those 2 teeth come close together, then we recommend to start flossing to avoid cavities.
All right. And then the last question is, what age should you bring your child in for their first dental checkup?
So we recommend seeing the child at least by 1 year of age.
Mm-hmm.
And we want to make sure that the kids have a good experience and like coming to the dentist, and also to prevent cavities.
All right. And then the first orthodontic checkup should be by age 7. Most kids don't need braces by then, but we just like to check and make sure that everything looks in order. That is all that we had for you today, guys. If you have any additional questions, please feel free to comment below.
Yeah, and thanks to Dr. Benson.